This is Connected Care Live, conversations with innovators and wellness professionals from all across the continuum of care. This series is supported by Solutionize, leaders in healthcare IT. You can find our entire archive of conversations on a range of topics in healthcare at www.solutionize.com. We'd love to hear from you. I'm Steve Cohen, your host, and today we are speaking with Professor John Quelch, Professor of Marketing and Healthcare Management at Miami Business School. He is also Dean of the Business School and a Vice Provost of the University of Miami. John is the author of numerous books and papers on the subject of marketing, with a particular focus on healthcare and patient centricity. His most recent book, with co-authors Gordon Moore and Emily Boudreau, and our topic for today, is Choice Matters: How Healthcare Consumers Make Decisions and Why Clinicians and Managers Should Care. John, welcome to CCL.
Well, thanks very much, Steve. Delighted.
So let's start with a snippet of the Oxford University Press description of your book. It's described as, quote, a timely and thoughtful exploration of the controversial role of consumers in the U.S. healthcare system. Why controversial, John?
Well, it really shouldn't be controversial, should it? Because after all, when we are operating in any market, we are really there to serve the needs, explicit or latent, of the consumer. And somehow or other in the healthcare system in the United States over the last 30 to 40 years, we've lost our way. It used to be the case, I think, back in the 1950s or early 1960s, that if you had a problem as a consumer in a community, you would go to the family doctor down the street, and you would be treated, and you would not be, I think, inflicted with a large, complicated bill from multiple parties whom you have no idea who they represent. Rather, it was a very personal experience to relate to the family physician in the community. We've lost that. We've lost that through the what I would describe as the industrialization of the healthcare system. And I think many doctors are as frustrated as there are patients who are frustrated by the bureaucracy and complexity that now invades the genuinely important process of giving care.
So once upon a time, each of us had a family doctor, and unless it was something very complicated or emergency, our primary relationship was with that person, but not so anymore.
Well, I'm glad you used the word relationship because, of course, trust is a key component in the delivery of effective health care. If the consumer or the patient does not trust the information or instructions being given, or does not respect the person giving them, then the adherence or compliance with those instructions is going to be diminished, and the result is going to be probably less positive for the patient. In many cases, we find these days that patients are very much better informed than they used to be. They have the ability to, of course, go on the internet and learn about many aspects of the conditions that they suffer from. They can potentially go and consult with other consumers facing the same situation on websites like Patients Like Me, for example. There are many ways in which consumers are empowered these days with more information than ever before if they wish to access it. And where we have a problem these days is that the doctor interacting with the patient, often doesn't have the amount of time that's necessary for them to take account of all of the information that the patient may be throwing at them. So, the relationship, therefore, becomes very, very important in sorting through what information is worthy of being trusted and what is not. I think it's still the case that in the final analysis, the doctor still holds the key to effective healthcare in the sense that more than any other source of information, the doctor in that face-to-face situation is going to be commanding a high degree of influence. But we have to take account of the fact that the patient is receiving information from many, many other different sources these days, and in order for the interaction between patient and doctor not to be just transactional, but to be genuinely building towards a trusting relationship, that requires time. That requires the doctor be able to invest time in that interaction. And we all know these days that doctors are incredibly challenged in the sense that they have many masters looking down on them, looking over their shoulder to see if they're being so allegedly, quote, productive, unquote. They're having to look at their computer screens when they're talking to us, when we visit them in a doctor's office. All of this is diminishing to doctors as much as it is to patients. Of course, technology has a place in the system. Of course, we have to have billing mechanisms that are not going to be subject to fraudulent abuse. But at the same time, we have to take account of the fact that the relationship between the doctor and the patient is fundamental to the delivery of advice that is likely to lead to adherence and therefore likely to lead to better outcomes.
Well, you've raised a lot of issues there, and several of which, if we have time, I'd like to come back to, particularly this issue of relationship. And you also noted time and technology, and that in many cases the patient's first relationship is with Dr. Google, right? Dr. the Internet. I'm going out there and getting information, and this touches on one of the issues of the market aspect of healthcare. One of the arguments against choice in the healthcare marketplace, in fact, against healthcare being a market at all, is that consumers are not in a position to make these choices. They don't have the information or the ability to process it to make meaningful decisions. So, what would you say in response?
Right. I really love the command and control pundits in the healthcare arena. I wonder if all of them are still using Merrill Lynch as their stockbroker, charging $80 a trade for 100 shares, as was the case 30 years ago, or whether or not they're gladly accessing all of the information that's available through a Fidelity or a Vanguard to self-manage their accounts in a much more cost-efficient and empowering way. My guess is that there's a little hypocrisy here in the air. In most other consumer markets, the progress towards consumer empowerment through the benefits of information technology and information delivery in a free market of information that exists on the internet, all of this has greatly assisted consumers building their confidence and building their capability and awareness to be full participants, intelligent participants in the delivery of financial services, in the delivery of retail goods, and why not in the delivery of healthcare?
Well, so that brings us to the question of Dr. Google and all of the information that's available. Can a patient, can a consumer process that information? Can they make a reasoned decision between the options when those options are available?
Well, again, I would say that we have to think in terms of a spectrum of consumers. Obviously, not all consumers go from 0 to 60 in 10 seconds when it comes to shifting from having someone else advise them on their financial investments to being fully in command and control of them for themselves. And likewise in the healthcare arena, yes, there are some patients who are deeply invested in, especially in those who have chronic or unusual conditions, deeply invested in researching on the internet on their own behalf, or engaging relatives and friends to help them do that with a view to not self-treating, but rather to be able to ask doctors whom they meet with intelligent questions. And most doctors I come across are very pleased to engage with that kind of patient. But at the other end of the spectrum, let's not be coy about it. There are people who are either unable, unwilling, or fearful, whatever the reasons are. They do not wish to learn much about their health care. They're the kind of people who, as soon as they get sick, will say, for God's sake, don't take me near a doctor or a hospital, or else I'm going to get worse. So there is a group of consumers who is deeply skeptical of the efficacy of the healthcare system. That's a problem for the system. And obviously, if they're particularly if they're suffering from chronic conditions and are physically or mentally challenged, they're not necessarily going to be able to dig up all the material on the internet to ask the right questions. So they're going to be more dependent on the physician and or the group of physicians that are called upon to treat them.
I'm glad you brought that up. That there's more than just one doctor. Often there's a group, but not only that. And I think, as you say, that's changed over time. It's become more complex. But there's other people in the question, and a major focus for us here on CCL is on the participants in healthcare who are not typically thought of as, quote, healthcare providers, such as county social workers, healthcare attorneys, family and other caregivers. So where do they fit into your model in terms of choice and patient empowerment or consumer empowerment?
Mm-hmm. Well, obviously, one would like to secure a holistic approach to bear upon the various needs that any individual, and I'm thinking particularly of chronically ill geriatric type patients with multiple conditions. These people are often, very challenged, as I said, physically and mentally as well sometimes. They're not in a position to look after themselves after they're discharged. There really needs to be coordination between the healthcare providers and social workers, visiting nurses, other forms of assistance, other providers of assistance, to ensure that the risk of them coming back to the hospital again is mitigated. So, to the extent that one can have a holistic, integrated platform in the cloud where all of these individuals can, if the patient chooses, be permitted to have access to their data to facilitate a conversation about a joined up solution, both in the short term and ongoing. This is a very, very sensible way of proceeding. Now, the one thing I would say as a little bit of a reservation here is that, to use the old proverb, too many cooks can spoil the broth. And so there does need to be some sensible vigilance around who actually is getting access to the patient's data. Of course, the patient can say yes or no, but nevertheless, I think some guidelines to patients who are suffering from particular types of conditions, to give them some guidance as to who might you think of including in your team. That would be, I think, a sensible thing to do.
Yeah, I noted an interesting chart in the book, which organizations, a survey of patients or people, of which organizations would consumers trust with their medical records, and far and away the number one was an insurance provider. But much farther down the list, in fact, the last on the list was my employer, who are interestingly
Yes.
often the provider of that, or very often the provider of that insurance. I'm sorry, of that, well, yeah, of that insurance, and therefore they are tied in with the most trusted owner of those
Yes.
records. But one of the
Yes.
options that's not listed is me. What if I'm the owner of those records?
Yes. Yes.
Is that not a possibility today, either technologically or legally?
Well, yeah, curiously enough, I mean, if you went to an African country, in many poverty-stricken rural areas, you will find that the person who has the medical records of a particular patient is the patient himself or herself. That they actually carry with them the medical records whenever they go to see a health provider, because the record keeping is so unreliable, and so often the records would be stolen if they were or destroyed or otherwise lost if they were in public custody. That the patient himself or herself is the most reliable collector and keeper of the information, and obviously has a greater self-interest than pretty much everybody else in the system to make sure the records are preserved. So I think what you say is correct. Actually, regarding the chart in question, I'm a little bit skeptical about the results in the chart in the following sense: that when people are asked a question like that, they typically answer with reference to how things are working today, how the world is today. And so it's not surprising to me that the insurer would come high on the list, because frankly the insurer is probably where the money is coming from, the reimbursement money is coming from in the final analysis, and you'd probably trust the insurer a little bit more than the hospital accounting office to get the number right. The insurance company is on the side of the patient when it comes to not wanting to overpay for hospital services, at least in most cases. So there's a little bit of yay saying, I think, among the respondents to that particular survey. They're not being given scenarios that imagine a different world, a different health system where there might be a much more interesting set of results, especially, as you say, if the notion of including yourself as a responsible party was included.
Interesting. So, we're talking around the issue of EMR, electronic medical records. So, one of the major legislative efforts to attempt to change and improve healthcare in recent decades was the 2009 law that mandated the use of EMR. You note in the book that although adoption has been rapid and pervasive, it hasn't really achieved what the law had hoped. Specifically, and somewhat ironically, I think to many doctors, the law requires demonstration of, quote, meaningful use, a technical term within the law. So what have you found with regard to the meaningfulness of EMR thus far?
Yes, I think the principal challenge is the integration of records across multiple service providers. And of course, with population mobility being what it is, and with chronically ill patients seeing specialists, not necessarily all from the same institution, you have a situation where a truly integrated record would require pulling together information from multiple sources. Now, if all of these sources happen to be holding their information conveniently in the cloud, then it would be much easier and quite economical to pull the data together. But as we know, several of these EMR companies, the largest companies, are essentially in collaboration with hospitals to retain the hospital records for the hospital in question, and not to easily facilitate the sharing of those records with other providers who the hospital believes might then step in and somehow or other market themselves to the patient and take the patient away from the hospital. So there's a little bit of protectionism that kicked in after this law was passed. The hospitals didn't want to share their data, and the electronic record companies basically aided and abetted that by developing complex IT systems that, of course, are advertised as being helping to ensure patient information is kept secure, but actually the real purpose is to prevent the patient information being conveniently shared across multiple providers to allow for an integrated view that is convenient for all parties who are helping the patient.
Which is, of course, what you said at the top, that's going to have that having that access to information is going to improve outcomes. And now you have the technology companies to some degree in I don't want to use the word collusion, but in conjunction with their hospital customers are trying to prevent precisely that. So now let me also note for our listeners that your book is explicitly directed to managers and policymakers within the world of healthcare. In fact, let me quote, if I may, from the preface for a moment. You say that most healthcare provider organizations, individual doctors, and health insurers remain woefully underprepared to navigate this transition from passive patient to active customer. Traditionally, they have not needed to adopt the consumer-focused strategies characteristic of other industries. Referral networks among providers have sustained their business models, while individual consumers have struggled to find information to inform them about services and provider alternatives. Though healthcare organizations have, for the most part, realized that new patient-centered strategies are necessary, many have faltered when it comes to implementation. So, given that rather bleak assessment, what is the importance of connected care with regard both to health outcomes and patient satisfaction? And if you have any thoughts on it, to whom does that satisfaction or dissatisfaction accrue when patients are in a connected model?
Mm-hmm. Yeah, so I'm glad you brought up the quote, because that really does summarize a rather bleak point of view. I think it really is the case that healthcare has greatly underperformed other sectors in terms of its focus on the end consumer. In fact, healthcare generally has, over the last 30 years, become essentially a business-to-business type of industry, as opposed to a B2C or business-to-consumer type of industry, where insurers are paying providers, and the consumer typically has not had that much of a role. Now, once you move into an era of high deductibles and substantial obligations for copays on the part of many consumers in the population, then of course you are going to attract their attention, and many consumers have had to become instant experts, or do their best to try to become instant experts at divining the arcane aspects of hospital and insurance company billing systems in order to try and keep their houses from being foreclosed upon. So we are at a very important tipping point, I think, here in terms of consumer and patient rights in healthcare. The degree to which there is pricing transparency is an extremely important weakness of the system at the moment. It's impossible, I think, for patients or consumers in any market to be able to intelligently and conveniently make comparisons if they can't make some sort of apples to apples comparisons between, let's say, one hospital and another in terms of its track record and its pricing. So we need very much to improve the level of transparency that exists in the marketplaces, and that can be done voluntarily or it can be done legislatively, but it's usually the case in this kind of an industry that it has to be done legislatively, and then of course the issue will be the lobbying power of the various entities that don't want transparency. You know, people who are making money by essentially exploiting the complexity and obfuscation of pricing structures in a market, you know, want those complicated, obfuscating pricing structures to stay in place.
Right.
They do not want simple transparency. And so this becomes one of the major battlegrounds, I feel, going forward for consumer rights and patient rights advocates.
One of the elements that you bring out is what you call the 6 E's, 6 elements of consumer choice in healthcare, among which consumers need to balance trade-offs, specifically effectiveness, empathy, economy, efficiency, experience, and empowerment. I think most people would regard the first E, effectiveness, as the principal concern. Can you fix my health problem? But perhaps don't pause to think about the ways in which the other elements interact and can become important at different stages of the healthcare journey. While I appreciated the detailed analysis of both the elements themselves and their relationships, my high-level takeaway was that even a well-educated consumer would find that level of decision-making at best onerous and at worst impossible. So how can consumers avoid being, and I'll use a too strong word here, avoid being victimized by this healthcare system, given the current structure?
So let me just comment on the 6 E's, because I think that these elements, these 6 benefits, if you like, or 6 criteria, do come into play in many of the decisions that we make. So, definitely you want let me give you an analogy. You definitely want your dishwashing liquid to clean dishes. But in addition, if it was able to also keep your hands from becoming chapped, if it was a mild dishwashing liquid, that might be a more empathetic dishwashing liquid than something that was much more strident and industrial strength. So I just use that as an analogy because I think it's important to understand that, of course, we look for effectiveness in every product and service that we attend to or deliberate about. But we have to recognize also that these other elements do come into play, and while they're not necessarily going to dominate effectiveness, they can sometimes be important as hygiene factors, let me use that term, hygiene factors that kind of mitigate problems that may exist in the system. To give you another analogy, if you're riding the train every day from Connecticut to New York, and every second day the train breaks down, I mean, obviously that's a massive effectiveness problem. If you happen to have a comfortable first-class seat and the Wi-Fi is still on so you can communicate with your office, that makes it more tolerable than if you're in a standing only situation, in a cattle car. So these other elements do come into play, and I don't think we should underestimate the degree to which they do come into play. Now, is everybody going to sit down every time they go to a doctor and scribble out on a 8 by 11 piece of paper a matrix that has these six criteria and rank order them according to rating of Doctor 1, Doctor 2, Doctor 3, and then add up the ratings and decide which doctor to go to? Many times we don't have the ability, the time, or the inclination to do that kind of meticulous analysis. But that doesn't mean that there aren't heuristics that are going on in our mind that are actually affecting the way in which we behave. And so the 6 E's is really largely a tool to enable clinicians and managers to think about how to decompose the ways in which consumers are influenced in their decisions, rather than necessarily to expect every consumer to follow a 6 E's analysis before they go and get a stitch put in their finger. But even in that particular case, I might add that, with the rise of urgent care clinics, which can provide that kind of an emergency service at a far more economical and efficient manner than an ER room can, in that case, both the ER and the urgent care clinic may be equally effective in putting the stitch in the cut finger, but the urgent care clinic might beat out on economy, might beat out on efficiency, and probably also on empathy as well.
Well, as we wrap up here, what's your prognosis, Doctor? What do you think the next, say, 10 or 15 years holds, both for the practitioners in the industry, but also for consumers?
Well, I think that there's going to be tremendous disruption in this industry. I think we haven't seen anything yet. The incumbent providers and insurers have been, happily accommodating and lobbying and bobbing and weaving to try and maintain their leadership position. Meanwhile, the patients and the individual doctors have been, the pawns on the table. I strongly believe that an Apple, a Google, maybe even an IBM with its Watson effort, one or more of these companies is going to change the way in which we access healthcare and think about our healthcare record keeping, think about the way in which we interact with the system, and force the system to change the way in which it interacts with us. So, I look again as an analogy at the financial services industry and what has happened to that industry over the last 30 years. And my conclusion is that we haven't even scratched the surface in healthcare in terms of going down that same journey.
Well, this has been a great conversation, and I wish we had time for more. We have been speaking today with Professor John Quelch. John, thanks for being part of Connected Care Live.
Thank you, Steve.
To get more insights and information from healthcare innovators and pioneers, go to www.solutionize.com.